Good evening, everyone. Nasi akoi Doctor Talks ki second episode hai tare. I'm interesting oiba topic ne akoi nisi purga lakte je and interesting oiba akoi ki specialty hai tare. Ada akoi nasi nagadori ba misak si akoi Doctor Nandan Choudhary ni ko. Ma se akoi ki MD in Palliative Medicine from AIIMS New Delhi tegi tarpa doctor ni, and currently he is working in Karkinos Cancer Hospital akoi Porompa liver cancer hospital da juzik work tori. Ado akoi ki introduction akoi ki keno tegi ta si doctor tegi. So doctor, welcome to San TV Doctor Talks program.
Thank you.
You can give a brief introduction of yourselves to our viewer.
My name is Kurunjari. I am Dr. Nandan, and basically I am from Nepal, and I did my MBBS in India, and soon after MBBS, I did my specialty in palliative medicine from AIIMS New Delhi. And after my specialization, I came to Manipur, and since then I'm working here in Manipur, and I'm looking after cancer patient mostly, and I'm currently working as a consultant palliative and supportive medicine at Karkinos Cancer Hospital, Porompa.
Okay, thank you, doctor, for your introduction. So we'd like to know what is people know different type of specialties, right? Maybe medicine or gynecology or urology, which are very popular, But palliative medicine is very new. To us also, the people of India also is very new thing, I think, this type of specialty. So we want to know what is palliative medicine.
Okay. Yes, it's a very new subject, and I am the first batch of palliative medicine from AIIMS.
Okay.
And before joining AIIMS, also I didn't knew about palliative medicine much. So it will be very new for anyone watching, like even doctors also. It will be very new for them to hear about this specialty itself. So it will be much like difficult for general population to understand what is palliative medicine. So I'll make it very simple so that people understand. So let's say a child is born, so there is a specialty called pediatrics. So the child is newborn is cared by a pediatrician. So but death is a natural phenomena, no one can escape death. Before dying, with someone having chronic illness, they tend to suffer a lot. So this was seen by some of the like healthcare workers in other countries, and they thought that okay, this kind of patient who are suffering from chronic illness, they tend to suffer a lot when they are in the process of in the last stages of their life. So this specialty was developed to improve the quality of life of such patient who are having chronic life limiting illness by like addressing their physical issues, like the patient might be suffering from a lot of symptoms. Also they might be suffering from social issues, psychological issues, spiritual issues. So palliative medicine is one of the such branches which take care of the patient in a holistic way, addressing all these issues. So this is the brief introduction about.
Okay. Group of patients you are targeting means what our group of patient is really benefiting from this palliative medicine.
Yes. So I mentioned about chronic life limiting illness. So I'll take few examples which can be benefited from palliative care. So one of the example is cancer patient. So most of the patient, like we know that the incidence of cancer is increasing in India. There are a lot of patient. If you look at your neighbors also, you'll know someone who has cancer. So whenever someone hears about cancer, they think that it's a death sentence. They get so much scared that they think that okay, now I'm going to suffer a lot. So that is one of the disease that we look after, and there are other diseases like let's say end stage lung disease. So someone who has COPD, someone who is a very chronic smoker. So when their like chronic illness of like lung disease gets into a advanced kind of form, when they are dependent on oxygen and they are so much like having burden in terms of disease, so that they tend to have to go to hospitals multiple times. So we think that okay, this kind of patient are going to have like the life is limited. This kind of patient also are benefited from palliative care. So the another example would be end stage liver disease. Someone having like chronic illness, like let's say cirrhosis patient. Cirrhosis patient is not going to get cured, so it's already irreversible kind of disease. Irreversible means the disease can't be reversed back, it can't become normal because of their own disease process. So this kind of patient, when they are in end of life, they get benefited from palliative care. Also, another example would be end-stage heart disease. Like lot of patients who are in 70s, 80s, they might have dementia, Parkinson disease, like Alzheimer's disease, or there might be a lot of like childhood illness, which there is no cure. Like there might be some muscle atrophy, muscle dystrophy, a lot of n number of diseases which can be benefited. But most of the troubled patient, I would say, is cancer patient.
Okay.
Who tend to suffer a lot. That's why palliative medicine, as such, right now in India, is developed only in the cancer hospital. Right now, I'm working in a cancer hospital. So mostly palliative medicine services are available in the cancer setup only right now. But it is growing and it is trying to like I look after multiple patients. I look after non-cancer patient also. Um, so yes, this is the type of patient.
Okay. So it is available in every cancer hospital, or
No.
it is not mandatory, right?
It's not mandatory because there are very less trained professionals, palliative
Okay.
medicine professionals
Okay.
right
Okay.
now.
Okay. And in a state like Manipur, what are the benefits we can get from palliative medicine?
Yes. So if you look at like what they say in the literature, that at least 10% of the population at one point of time might be suffering from some kind of life limiting illness. There might be many patients right now who might be in 80s. They might be having multiple illness. They might be at their last like last few months of their life. And let's say the population of Manipur right now is 30 lakhs. There might be at least 3 lakhs of the population who might be suffering silently somewhere. They don't know what to do at this at their stage of time. They might be just waiting for their time to die.
Okay.
They don't know how to where to go, how what to do at that time. Suppose the patient is having a lot of patient is bedridden. Patient is having a lot of pain. Patient is having like bed sore. Patient don't know how to change the catheter, urinary catheter. There are a lot of things that happens at home, and they will be suffering a lot, and they will suffer and they will die at their in a bad condition only. How palliative medicine can help? uh, let's say there is one patient who is at end stage kidney disease. Let's say the patient is dialysis dependent. They're going to hospital multiple times for dialysis, and even after dialysis also now the patient is not improving a lot, and the patient requires the kidney transplant. And even the kidney doctor, they know that okay, the patient is going to die in like a few months or maybe 1 year, and the patient might be very poor, or sometimes they might not be affording, because it's a big amount of money going to hospital multiple times in a year. Because they tend to not only go to the general ward, but they might go to ICU also. It's a big amount of money. So with palliative care, we sit down and discuss with the patient that okay, your illness is gone really far, and we discuss about the goals of care, what the patient really wants. Sometimes they don't know, they think that okay, going to hospital in ICU will cure their illness, but they don't know whether it's curable or not. So they tend to spend a lot of money in an unnecessary way. Someone might be having small land, they might be thinking, and someone might be. I still remember one of the patient who was a like rickshaw driver. They had one small land, I still remember, and the patient was this dialysis dependent, and the patient required like kidney transplantation, and the patient was in ICU, and the patient spent a lot of money, and they had to sell their that small land also, and they had, I think, few kids. So with my expertise, I can tell them that okay, there's no need to go to ICU, because anyways you are going to die. So I give a truthful kind of information to the patient, then they decide what is good for them.
Okay.
So because patient has to know all the information. Without the proper information, they will not decide what is good for them. They will think that okay, whatever doctor is doing is good for them, but sometimes they don't get proper information. They think that okay, going to ICU will cure their disease, but when they understand okay, my disease is not going to get cured, and I have my few children whom I have to look after for future, and this is the only source of money that right now I have, and it's not going to benefit. So they will think okay, I will die, but I will die getting palliative care, so that I don't suffer whatever time is left, and I have a good quality of life. At the same time, I don't spend the money unnecessarily. Because India is a resource limited country, so we have to be very judicious when we utilize resources. We can't misuse the resources. I'm not saying misuse, but yes, someone who really needs has to be utilize the resources. so that we don't spend a lot of money in unnecessary things. So this is the role of one of the part I'm telling you right now of how palliative medicine can help some patient.
Okay. Si matang sa tang Manipur dong tang ay handok sa ke machumbalan ba di means loin mag atra handok mo trago sa chawk ko yung important ba message ne khanjai ko ay mo ta ke ne khoi gi palliative medicine doctor in hybrid se khoi gi Manipur yam thokpa India su yam thokpa case situation hai tare ko khoi gi patient man nare nara kanda magi se for example hojik doctor na example pi bira dialysis patient ma ma se kidney transplant tau da yadre adagidi haibire ko mang su ada ma se akhoi stage handle lak pai tare ada paisa di paisa da family do akhoi sida hospital da thamaga ICU da kaida leibagi muhutta akhoi palliative care lobiraga palliative specialist ma tanabiraga ma se kaido bo yai hojiki magi stage na karino life span se kamain taroga leidorige then akhoi sida ICU lerga benefit leigadra leiroidra ICU da lerga or hidak myam sa phagalakadra phagaloidra haibagi keno haitare ko अखोगी अप्रोच हाइतारे डिस्कशन हाइतारे फैमिली मेंबर्स अदगी मयाम दुगा डिस्कशन तौरकान ए सुमाइना सी तौबा याइने हाइबगी केयर हाइतारे को अदुगी ट्रीटमेंट हाइतारे को अदुगी खनबा नैनाबा हाइतारे को अदुगी मतंगदा देन अखोगी तुंगी फ्यूचर जो हाइतारे मान होजे एग्जांपल पिबिरो पदा अखोई रिक्शो ड्राइवर अमा मागी लम योन थोगा अदमाइना आईसीयू लेर खोला तौरगा लम दुसु मांग फ्यूचर अंगांग फ्यूचर सिमोदा leisu leihida nungai budi ke nona te tarsu tung da wa hawbodo adugumba so dum loinamak yawe haitare sigi specialist sida daidi kari kari kuina sangna for example sei ama legda khang hengkatna ba kedo bu yai ko pe adum khana na bai tare ko yamna diff oiba keno ne subject ne ada khoina su yamna sidam knowledge leibna te ado mana khar khai ko dani khar Manipur da hayak pani aswer ngam yaw so me dum ngapi ko ada makhata na mo khoi doctor ge mukta se some examples khara kai kai kamain to bu ya ge haibo that's it. So yeah, I was explaining to them a little bit. So in future of Manipur, how much need will be there for a palliative specialist in the future?
Yeah. So I would say as the whole India, I would say not only Manipur, as the whole India. So number one is that a lot of cancer incidence is increasing. So there are a lot of cancer patient, and I told you looking at the recent data, almost 60 to 70% of the patient was diagnosed with cancer. They're diagnosed at stage 4.
Okay.
So I'm not telling that stage 4 is incurable, but yes, most of the patient they will not get cure, and their disease will keep progressing despite getting therapies like chemotherapy, radiotherapy, or surgery. So they have a lot of suffering. So this kind of patient, my specialty, I look after this kind of patient who are having stage 4 cancer. So my specialty makes sure that this patient doesn't suffer, and at the same time they also adhere to the chemotherapy, radiotherapy, and surgery. What happens is in cancer patient when they're receiving chemotherapy or like radiotherapy, they get a lot of symptoms because of the side effect of cancer or maybe side effect of the treatment itself. So they think that okay, I'm suffering a lot, I'll not go through this treatment. So sometimes they forego their treatment also. They think that okay, this is not going to help, I'm already diagnosed with cancer, so I'm going to die in suffering. So my job is to make sure that they don't suffer, and they have good quality of life. And so now as the healthcare system has improved a lot in this decade, so many people like general population, they are living up to 80s. And when they're living up to 80s, they get multiple comorbidities. We call comorbidities in medical terms, means they have multiple problems like hypertension, diabetes, kidney disease, or let's say dementia, forgetfulness, multiple symptoms they have. And when they're 80s, they need constant care. So what happens in other countries, I'll just compare right now. In Japan, what is happening, there is acute shortage of healthcare professionals right now, because there are many, their bulk of population is in 80s right now, 80s and 70s. Their old elderly patients are a lot right now, and they need a lot of care. And what happens is right now, suppose someone is suffering at home, there will be some people to care at home only. But let's say after 30 years or 40 years, what will happen is most of them will be most of the people of Manipur also might be having some job. So it will be very difficult for them to leave job and take care of their loved ones. So in that, so this is what is happening in other countries is that this kind of patient are cared in long-term care center or some proper centers where they keep them. Suppose you have to go to some work, right? There will be no one to look after your parents or your loved ones, so they keep them at that center for that much of time, and then when they come back after 2 days or 3 days, then they can be cared at home also, so that they don't get disturbed with their like in their job also, and they don't get burden also. So what happens is, if they care for like many days, suppose someone is having fever, let's say fever for 5 days, give antibiotics and they get cured. Caring for them is very easy. But someone having long term illness, you have to care 24/7, right, for multiple days. Even the caregivers, they get over stress, over burden, and after some period of time, let's say after 1 month or 2 months, they'll get irritated. They'll not have time for themselves also. They'll think that okay, they'll start getting irritated, and they'll everything will become very messy.
Yes.
So that time, this kind of centers will be very helpful. So palliative medicine will be very very useful in that times, in opening up. I don't know if you know or not, hospice. Do you know? Have you heard about hospice centers? Okay. So hospice is one of the centers where someone who is having less than 6 months of time are cared. So let's say any patient who is end stage heart failure or end stage liver disease or cancer patient, the doctors will know. Someone who is a gastroenterologist looking after a liver patient, they'll know that okay, this patient is going to live less than 6 months. So this kind of patient are cared in that center, because that caring for 6 months is a big burden for someone at home. They'll not be able to give the proper care. So the term hospice care is for someone who is having less than 6 months of prognosis, to give a special care for them, so that they don't suffer. And it can be given at some special center, like there are some special buildings. There are a lot of hospice centers in US, many countries they are developing now. In Delhi, Mumbai, Bangalore, they have multiple hospice center. In Manipur, we don't have hospice center. In Odisha also there are many hospice centers. Nowadays it's developing. So this kind of centers will help this kind of patient. So the demand of palliative medicine will keep increasing a lot.
Okay.
Even after training, the number of training happening right now will be very very inadequate, even for 50 years. Next 50 years also.
Okay. So how many palliative specialists is here in Northeast India and
Northeast India? I am the only one.
Okay, you're the only one.
Yeah, and Manipur I am the only one specialized in palliative medicine.
Okay, okay.
Yes.
In Guwahati also there is no any palliative.
Yes, one of my junior recently passed out from AIIMS, and she's doing she's working in Guwahati right now.
Okay, okay. Okay, sige palliative medicine specialist. Okay, doctor dang ne ma hojik Dr. Nandan Choudhary dang ne okay Northeast ko na le se junior sa tak thok le hare. Aduna okay Manipur ki yam lucky ni hai tare doctor ne sida pambira ko work to se yam noi hai tare ko doctor na sida Karkinos care da okay work to ko le se. So I'll come to the.
I'll add one point.
Yeah, sure.
In Manipur, how palliative medicine will be helpful. So there is something called I told you about hospice care. There's something called home care, home-based care. So my specialty. So when the patient is suffering, when they are at end stage, they'll not be able to come to hospital. They'll be bed bound.
Okay.
Bed bound. Now bringing them hospital is a big challenge for even the patient also. They'll get troubled a lot. The care at home is much different than hospital.
Okay.
Because they have psychologically they are much they feel better that okay, they are getting the best care.
Yes.
So my specialty, I look after. I have been to many places in Manipur. I have been house to house.
Okay.
Even during this problem time also, I have been to many houses.
Okay.
I've helped many people. So I think home based care is one of the big thing that can help many patients.
Okay.
That's why I wanted to focus.
So means I can give your phone number to the patient.
Yes,
anyone. So I can
help.
I description the doctor ki phone number hapsaramge akoi yum da adum chronic illness hai tare ko adum naraga laiba khotma doctor adum consult to bi yani ma su mate adum pangjarakani mayam da su I will put the number and you can help those people who needed you.
Definitely.
So what services, if you are going to the places, what services you are going to provide to them?
So let's say there is one cancer patient who is stage 4 cancer patient. So what happens is it depends on the symptoms. I'll basically will be managing their symptoms. So symptoms can be, let's say someone is having lung cancer. So someone having lung cancer, the tumor will be in their lungs. So the lungs will be damaged. So they'll have cough will be there. Difficulty in breathing will be there. They'll have lack of sleep. they'll have pain because of the tumor, they'll have tiredness, they'll have like fatigue, they'll have n number of symptoms there. There are multiple symptoms. Vomiting can be there, constipation can be there, loss of appetite, multiple symptoms can be. So my job is to make sure I find out, explore all these symptoms,
Okay.
and I prescribe medicines for that.
Okay.
And at the same time, I make goals of care for them. Goals of care means, does the patient really know their diagnosis or not? Sometimes they don't know whether they have cancer or not. They think that, okay, I'm just having some cough or some like pneumonia or fever, and I'll be all right after 7-10 days.
Okay.
So I make sure that they get that information. It's not like I will force them to know that information.
Okay.
I'll just explore. I have the skills to explore whether the patient wants to know the diagnosis or not. If the patient doesn't want to know the diagnosis, I will not tell them the diagnosis. But yes, if they want to know the diagnosis, it can help the patient, because sometimes if the patient know the diagnosis, they will think that, okay, I have only 1 year left, so I will enjoy my life. I will do whatever is pending in my life. There might be a lot of things the patient might have wanted. Maybe the patient might have wanted to go visit some places. Maybe patient wanted to visit her daughter, or the daughter might be studying in US or UK. He might want to be with spend some time with the daughter, spend some time with family members, or go somewhere, or maybe daughter might be unmarried. That is a big thing, right? So he might make sure that, okay, before I die, I'll just make sure that my son or daughter is getting married, so that he'll die peacefully. So I make all these goals of care, whether the patient wants chemotherapy or not. Sometimes they don't know whether the chemotherapy is going to help them or not. So I look at all the papers and all the scans and labs and everything, and I'll tell them, okay, this is your condition, and these are things that is going to benefit you, and these are things that is not going to benefit you. I give them truthful or factful
Quality
information.
advice.
Yes, quality advice. I can't be biased.
Yes.
My job is to make sure that I give proper information.
Okay.
And then they decide whatever they want.
Okay. Okay. So it will be a paid service or a free service?
Yes, most of them time I am do free service.
Okay. Okay. Fine. ꯑꯩꯈꯣꯏꯒꯤ ꯃꯌꯥꯝ ꯕꯦꯗ ꯔꯤꯗꯟ ꯑꯣꯏ ꯂꯩꯕ ꯐꯃꯨꯡꯗ ꯑꯗꯨꯝ ꯂꯥꯛꯑꯒ ꯂꯩꯕ ꯀꯩꯗꯧꯗꯣꯏꯅꯣ ꯈꯪꯗꯕ ꯅꯥꯔꯒꯗꯤ ꯂꯩꯕ ꯑꯗꯨꯒ ꯁꯤ ꯗꯣꯛꯇꯔ ꯆꯠꯂꯒ ꯄꯩꯁꯥ ꯇꯤꯡꯒꯗ꯭ꯔꯥ ꯑꯗꯩ ꯀꯩ ꯇꯧꯗꯣꯏꯅꯣ ꯈꯪꯗꯕ ꯃꯌꯥꯝꯁꯨ ꯂꯩꯕꯤꯔꯒꯅꯦꯅ ꯈꯜꯂꯦ ꯅꯥꯗꯤ ꯅꯥꯔꯕ ꯑꯩꯈꯣꯏ ꯀꯦꯟꯁꯔ ꯅꯥꯕ ꯑꯣꯏꯒꯦꯔꯥ ꯗꯦꯟ ꯑꯩꯈꯣꯏ ꯑꯦꯅꯤ ꯂꯪꯁ ꯔꯤꯂꯦꯇꯦꯗ ꯑꯣꯏꯒꯦꯔꯥ ꯍꯥꯔꯠ ꯔꯤꯂꯦꯇꯦꯗ ꯑꯣꯏꯒꯦꯔꯥ ꯑꯣꯔ ꯑꯦꯅꯤ ꯀꯔꯤ ꯂꯩꯅꯥꯅꯣ ꯈꯪꯗꯅ ꯑꯗꯨꯝ ꯅꯥꯔꯒ ꯑꯗꯨꯝ ꯂꯩꯕ ꯀꯔꯤ ꯂꯩꯅꯥꯅꯣ ꯈꯪꯗꯦ ꯑꯗꯨꯝ ꯅꯥꯔ ꯐꯃꯨꯡꯗ ꯑꯗꯨꯝ ꯀꯨꯜꯂ ꯂꯩꯔꯦ ꯍꯥꯏꯕꯒꯨꯝꯕ ꯗꯦꯟ ꯁꯥꯏꯀꯣꯂꯣꯖꯤꯀꯦꯜ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝ ꯂꯩꯕ ꯃꯌꯥꯝ ꯂꯩꯕꯤꯔꯝꯒꯅꯤ ꯑꯗ ꯑꯩꯒꯤ ꯗꯣꯛꯇꯔꯒꯤ ꯅꯝꯕꯔ ꯑꯗꯨꯝ ꯑꯩꯈꯣꯏ ꯗꯤꯁꯀ꯭ꯔꯤꯞꯁꯟꯗ ꯍꯥꯞꯆꯒꯦ ꯑꯗꯨꯝ ꯀꯣꯟꯇꯦꯛ ꯇꯧꯕꯤꯌꯨ ꯃꯥꯁꯨ ꯑꯗꯨꯝ ꯂꯥꯛꯑꯒ ꯌꯨꯝꯗ ꯂꯥꯛꯑꯒ ꯑꯗꯨꯝ ꯐ꯭ꯔꯤ ꯁꯥꯔꯚꯤꯁ ꯑꯗꯨꯝ ꯌꯦꯡꯖꯅꯤ ꯀꯩ ꯀꯃꯥꯏꯅ ꯇꯧꯕꯅꯣ ꯈꯣꯠꯄꯅꯣꯅ ꯁꯤꯅꯦ ꯃꯣꯏꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯄꯦꯂꯦꯇꯤቭ ꯃꯦꯗꯤꯁꯤꯟꯒꯤ ꯀꯩꯅꯣ ꯇꯧꯕ ꯍꯥꯏꯇꯥꯔꯦ ꯃꯊꯧ ꯍꯥꯏꯇꯥꯔꯦ ꯃꯤꯒ ꯌꯥꯝ ꯏꯟꯇꯔꯦꯛꯁꯟ ꯇꯧꯔꯒ ꯑꯩꯈꯣꯏꯒꯤ ꯅꯥꯔꯤꯕ ꯄꯦꯁꯦꯟꯗꯨꯒ ꯏꯟꯇꯔꯦꯛꯁꯟ ꯗꯦꯟ ꯃꯥꯒ ꯑꯩꯈꯣꯏꯒꯤ ꯌꯥꯝꯅ ꯐꯕ ꯔꯤꯂꯦꯁꯟ ꯍꯥꯏꯇꯥꯔꯦ क्वालिटीꯗ ꯗꯤꯄꯦꯟ ꯇꯧꯕ ꯍꯥꯏꯇꯥꯔꯦ ꯑꯗꯨꯒꯨꯝꯕꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯅꯤ ꯑꯗ ꯑꯩꯈꯣꯏ ꯑꯗꯨꯝ ꯑꯩꯈꯣꯏꯁꯨ ꯌꯥꯝ ꯅꯧꯔꯤ ꯍꯥꯏꯇꯥꯔꯦ ꯁꯤꯒꯤ ꯃꯇꯥꯡꯗ ꯑꯥꯏꯗꯤꯌꯥꯁꯦ ꯍꯥꯏꯇꯥꯔꯦ ꯑꯗꯨꯅ ꯑꯩꯈꯣꯏ ꯃꯊꯪꯁꯨ ꯎꯅꯅꯕꯁꯨ ꯄ꯭ꯂꯥꯟ ꯇꯧꯖꯔꯛꯈꯤꯒꯦ ꯁꯤꯒꯤ ꯃꯇꯥꯡꯗ ꯑꯩꯗꯤ episode amtang daka taba na kali I think I need another episode regarding this palliative medicine because it is very new to me also and to people of India also and even to the people of Manipur also. So by doing some case study, visiting together means doctors and our scientific team we can visit to one means patient and we can cover that videos and we can do this live session also over there. And we can,
I think this will be very useful for many patients.
Yes, because it will be say by discussion only. Most of people won't understand. I think even for me also, I'm doing little bit of research also. I'm not too much in this topic. So if we provide the live session to them, this is palliative medicine what we are doing. Then it will be a very good thing to the people also, to the patient also.
So like I told you, there are very less palliative medicine expert.
Yes.
So WHO, along with one of the society I'm working right now is Palliative Care Society Impal, which is NGO. So we do like free services, home to home visits, and we help many cancer patients with like whatever services they need. So we train volunteers because it's not possible for me to visit. Like let's say I get like 20 calls tomorrow.
Yes.
I might get 50 calls also. It is possible. I get a lot of calls. So they keep telling me to visit their home. It's not possible for me to visit every home. But yes, if I train volunteers like you, if I train you, at least you can go and do something, right?
Yes.
Sometimes just being with the patient makes a lot of difference. Touching their hand makes a lot of difference. Telling them that, okay, I'm with you. Don't worry, I'm with you. I will help you. That makes a lot of difference. So I train a lot of volunteers. I tell them, okay, come up, do something for the society.
Okay.
It's not possible for me to go to visit everyone,
Okay.
but that's why we have a volunteers training program. I train a lot of volunteers,
Okay.
and then I tell them, okay, visit, and then they will go and visit. They will inform me, okay, this is the problem. If they can do something by their level, they will do. If they
For that
can't do,
for that volunteer, any qualification is needed?
nothing. Anyone
Okay.
this can do. WHO a training program.
WHO training program is
Yes.
there. So how much days for the training
It's a
program?
16-hour training program.
16 hours training
Yes.
program. On this is online training program or
Offline.
offline training program?
Yes.
Okay, fine. Okay, so volunteer or in bagisu doctor ki makha da any qualification lo yai ada doctor ki makha dum training dum low ya ni si matang is very good information I think we're
Yes.
providing. So yeah, for lastly I will means last question I will ask. See in yeah, we have already said previous also in the previous discussion also in Manipur how much effective will be this palliative medicine in our day-to-day life or whatever situation is there, how much effective it will be there?
Yes, like I said, palliative medicine main aim is to improve the quality of life. So I can't tell you how much patient they suffer. You can't imagine how much they are suffering. Someone who has really cared for someone who is suffering, they will know how much their loved ones have suffered. So I'll take example of cancer. So one of the most like common symptom in cancer patient is pain. So when they have pain, it's unimaginable. You can't imagine how much they are suffering. Even like 5 minutes of that kind of pain is like the worst thing that can happen to that person. So with palliative medicine, we make sure that they don't suffer at any time. I give my phone number to all my patients. I tell them call me anytime. I make sure that I respond to them. I think I respond to every all the patient. If we have time. If I don't have time, I'm busy, and I try to make sure that I call them back, and make sure that they don't suffer. So it's very important that they don't suffer. That's why palliative medicine is very important right now.
Okay, okay, fine. Yeah. अखोई कहीं मथंगी एपिसोड तसु स्पेशलिस्ट मैम उनजरके अदुगे एपिसोड अमसु अखोई डॉक्टर की मागी अमतंग हप्सनजरके अखोई पेशेंट अमा कोई उनरगा चटपगी अमतंग लाइव सेशन होगेरा और एनी अखोई सिगी कवरेज वीडियो होगेरा अखोई रिकॉर्डेड वीडियो होगेरा अमा हप्सरके अदुगा पेशेंट कमाई इंटरेक्शन तौगे पैलेटिव मेडिसिन कमाई तौगे हाबदो अखोई नंबर पीबदुदा नंबर कॉल लाको और एनी व्हाट्सएप मैसेज लाकोदगी पेशेंट अमा लखोचरगा अखोई उनबा लक्सगे अदुगा अखोई मथंग स्पेशलिस्ट मैम उनजरके मैम जो कमेंट पिबिरमु कना कना उनो हाइबनो करम कम स्पेशलिस्ट उनो हाइबनो जो हाइबिरमु अखोइनसु लाइन अप खरा लेजरे. Thank you doctor for giving your valuable time. Thank you so much.
Thank you.